welcome back to my channel. My name's Joanne and I'm a mum of 3 children here in the UK. Today, following on from my previous video where I talked about my daughter being diagnosed with type 1 diabetes when she was 2 years old, I wanted to talk about what her life looks like now. So my daughter now is 4, almost 5, and so she's had diabetes for over half of her life. And at this point in her life, because she is so young, it's really myself that manages her diabetes for her. So we do that at the moment through a combination of a continuous glucose monitor, which is something attached to her and it sits just under her skin. We change it every 10 days, but for the duration of its life, it tells me what her blood sugar is at any given moment. It sort of updates every 5 minutes, and that information comes through to either a monitor or at the moment my phone. And so I can see her blood sugars around the clock, and I'm also alerted if her blood sugar goes out of range. So we use the Dexcom G6 at the moment, and the Dexcom G6 you can set alarms so that it will, for example, alarm me if she goes low at night so that I know to wake up and feed her something, or it will alarm if she goes high so that I know that she needs a little bit extra insulin, or that the insulin hasn't taken effect yet. So that's a really, really handy piece of equipment that we've had since our daughter was first diagnosed. So as soon as she was diagnosed with diabetes in the hospital, I think not the first day afterwards, but the day after that, the first day that we met with the diabetes team at the hospital, they put a sensor on her so that we never had to guess when she would be going low or high. And so knowing when my daughter goes low is really, really important for us, because a low blood sugar isn't what I think a lot of people imagine of, oh, okay, you know, they'll get a bit shaky, maybe not feel very well. A low blood sugar in a type 1 diabetic is actually really serious, and it can result in a loss of consciousness, even death if it's not treated, and so it has to be treated really seriously. And for type 1 diabetics, they usually suffer with lows like frequently throughout the day, because the issue is when you're injecting insulin in against what you're eating, it's hard to be as precise as you need to be, because activity levels change. Perhaps you've got a cold coming on and your body's, going higher than usual, or your blood sugar is a bit lower than usual. Perhaps you went for a long bike ride yesterday and that's affecting you today. Like, there's a lot of things that can affect a person's blood sugar levels, and so to keep it in that balanced range of like 4 to 8, or we actually have a target range of 4 to 10 for our daughter because she is so young, keeping it in that target range is quite tricky. And so it does happen that our daughter will go low during the day or during the night, and we have to respond to that. If we didn't respond to that, then that would be a medical emergency. The other thing you don't want is a person being high too much of the time, because their blood sugar being high puts a lot of strain on the body, and then that can lead to things in the future of things like kidney failure, loss of limbs, blindness. Like, there's some really nasty side effects to not managing your blood sugar levels well. So obviously, as her parents, my husband and I are really invested in making sure that we're on top of our daughter's blood sugars, making sure that we're there to treat her in either way she needs, because she's not able to respond herself yet. She's starting to identify when she's going low. There's like a certain feeling a lot of people feel, but not everyone does have a good awareness of when they're going low. And our daughter's is definitely still a little bit hit and miss, and it was, I would say, the first year or 2 of her being diabetic, it was very hit and miss. Like, she would sometimes get down to she wouldn't have symptoms unless she got under 2. Like, if her blood sugar was reading under 2, she would be shaking. Obviously we haven't got much lower than that. I think the lowest she's ever read on her sensor was 1.8, but that's obviously a scary situation if you've got a child that's shaking and reading such a low blood sugar level. And like I say, because we have the sensor, we're alerted a little bit before that. So as well as my daughter wearing a monitor to monitor her blood sugar levels, she also now has an insulin pump. So for the first year of diagnosis, she didn't have that. She had an insulin pen. So it had insulin in it. You get the insulin in little vials and you store it inside the pen. And then for her paediatric needle, you could dial up units of insulin in half unit increments. So every time she would eat, we would have to inject her with a fast-acting insulin. She had two pens actually, a fast-acting and a longer-acting insulin that she had to have as well. And so every time she ate, we would inject her as much insulin as she needed. And we calculated that depending on the amount of carbohydrates that were in her meal. That worked well in terms of keeping her blood sugar in a good range. And I don't think the injections hurt too much, which is obviously hard for me to say because I'm not the one being injected. But from what other type 1 diabetics have told me is that it's not like a huge needle like this. Like the needle is a bit smaller. But I think when my daughter would get fed up with being injected so much, understandably, and I don't know, you can never tell if you're hurting someone when you're doing that. Sometimes she would cry, and I don't know if it's because I had to hold her still to inject her because she was just fed up with the injections, or if it was because sometimes it hurt her. I think my dad says that sometimes if you catch yourself in the wrong place, it can be a little bit stingy. And so, yeah. So we moved on from injections, but that was what we did for a year. We did up to 8 of the fast-acting ones in a day because she's very snacky, and because with 2-year-old, she was 2 at the time that we started using the insulin pen, she would graze, and you couldn't put a meal in front of her and guarantee that she was going to finish it, but you also couldn't not inject her because as she's eating, her blood sugar would be going high. So so we had to do up to 8 injections, short-term injections a day sometimes. And then she also had her long-acting insulin, which is the one you typically give at night. She had that as a split dose, so she actually had one of those injections at night, which I would do after she fell asleep, but also one in the morning, which I would try and do if I woke up ahead of her, but oftentimes I didn't. And so yeah, so she was getting up to 10 injections a day at that point. So because of that, myself and my husband, we wanted to find something else for her, like some alternative to that. And we talked about pods a little bit with our diabetes nurse when our daughter first went diabetic. Our nurse felt that these sort of first few months we should be on pens, because if the pod ever fails or your insulin pump ever fails, you have to revert back to using pens. There's no option. You can't just go without insulin for very long. And so she felt that it was best to learn how to manage the pens just in case the pumps ever did fail, which I think was good advice. But yeah, after a year, we asked if we could go onto a pump with her. Luckily, I mean, because our daughter's so young, she was top of the list, the waiting list, and so she got onto a pump quite quickly. We chose the Omnipod as her insulin pump, and the reason we chose that is because it's a patch pump, which means it doesn't have any tubing. Most of the pumps that we looked at do have some form of tubing, which meant that she would have to carry around like I don't know what you call these, like a bum bag or a fanny pack, I think it's called, like something you tie around your waist, like clips around your waist, and then she would have like a little device, like a mobile phone there, and then the tubing, and then the injection site wherever on her body. We don't do that because we felt that her being so young, she was really bound to fiddle with the tubing, although I've heard that other people get along with it fine. But for us, we just felt like she wasn't the type of child that would benefit from a pump that had any sort of tubing. And so when we saw the patch pump, we really felt that that was the way to go. So now my daughter wears a decent sized insulin pump. It's hard to look at on myself because obviously my arms are a lot bigger, but if you see the thumbnail for this video, you'll notice that she's wearing it in the thumbnail. And so she wears that on her upper legs or upper arms or upper legs. And she, again, has to wear that all the time. The pod is changed every 3 days. And when you change it, you inject 100 units, at least 100 units of insulin in to activate it. You pop it on the skin, a cannula type thing releases, and then it sits under her skin for 3 days. And then once the 3 days are up, you have to change it. But during that 3-day period, it's giving all of her background insulin as well as the insulin that she needs every time she eats. And so that's worked really well for us because it's cut out all the injections. The only con I would say with it is that if anything happens to it, like it stops working or it gets knocked off, she does build up ketones very quickly. And the reason she builds up ketones so quickly is because, like I say, the pump has no long-acting insulin in it. So it has the quick-acting insulin, and what it's doing is it's sort of talking to the sensor via Bluetooth, getting the up-to-date blood sugar levels, and then adjusting the amount of insulin it's giving in the background in response to her numbers. And so if it fails for any reason, then it will, like, all of the insulin that she has in her body stops, right? Like, she's getting no more insulin. And then, so because she's getting no more insulin, then ketones build up. And if you saw my previous video, then I think I briefly talk about DKA in that video. But that's obviously a really serious complication that diabetics can have if their blood gets acidic through the build-up of too many ketones. So as I mentioned, the pod, her insulin pump, has to be changed every 3 days, and her Dexcom sensor is changed every 10 days. And so the way that we manage that is I try to change these things at night. My daughter still, understandably, because she's young and because when you change it, there's a sort of cannula that goes under the skin. So I imagine there's like a sharp scratch as if you are having an injection for that first time it's put on. Because of that, she's got a little bit of anxiety around having both of those pieces of equipment changed. But as much as possible, I try and change them at night now. Unfortunately, sometimes the equipment fails during the day, like or it gets knocked off. That's happened a few times because they tend to be worn on the arms and legs, and those are places that when she's running about with her siblings or her friends that get knocked. And so sometimes they do need changing a little bit earlier. If her Dexcom comes off during the day, because every time it's changed you have a 2-hour blank period with the Dexcom G6 where you can't see blood sugar at all, I change that as soon as I can, and she does. That means that she will be awake for that if it's come off during the day. But if it's her pod that comes off, then what we found is a bit kinder for her is to revert back to injections for the rest of the day, and then once she goes to bed, I will change it then, as I would normally do. I take it off. It's quite, both of the pieces of equipment have to be quite sticky, right? Because they need to stay on your skin for the 3 to 10 day period. But because of that, it can be quite hard to get it off. So we either use like an oil around the edge, there's special wipes you can get, things like that to help remove it. There's a spray as well, actually, we've used before. And so I'll do that when she's sleeping. I think one of the main things that people who are diabetic, or myself as a type 1 diabetic parent, would want other people to know is that type 1 diabetes is pretty relentless. It's a 24/7 job. There's no switching off from it. I was talking to my dad recently about this, and he said, sort of mentioned the point of, like, it's not like a blood pressure tablet where you take the tablet in the morning and then you can forget about it for the rest of the day. It's having that constant awareness day and night of what your blood sugar's doing or what your child's blood sugar's doing, whether they're going to need more insulin, less insulin, whether you're going to have to wake them up and give them something to eat, whether you're going to have to get up and get something to eat if you're the one suffering with diabetes yourself. There are nights where I've just been up all night either correcting my daughter's blood sugar or trying to get her blood sugars to pick up, and and having to feed her more and more. and there's times I've just gone to bed absolutely exhausted, thinking, oh, I wish I didn't have to deal with this tonight. But of course you can't switch off from it. It's not an option. You can't ignore a low, as I said. Like, the results of that could be devastating, and you can't really ignore highs either, because the long-term effects are so serious of doing that. And especially, I think, for myself, I'm dealing with someone else's body. You know, I'm dealing with this for my daughter, and I don't want to handicap her in any way. Like, I don't want to ruin her health for the future, because I've not been putting my full effort into managing her diabetes, you know, at this period of her life. And we've got, you know, from age 2 up until whenever she can take it over herself, it's my responsibility to make sure that we're doing the best we can to manage that for her. And so another thing, like another myth I'd love to bust, if I could, would be the confusion, I think, of type 1 diabetes and type 2 diabetes. And again, I understand why this happens, because they're both called diabetes, but actually the pathology behind them both and the management of these two illnesses is completely different. And so I have had people, because they're a bit confused about the difference between them, say things like, oh, if you just eat better, if you give your daughter a different diet, I've heard people sort of giving all sorts of different advice, then you'll be able to come off your medication. But unfortunately, with type 1 diabetes, I don't know about type 2. I'm not anyone to talk on type 2 diabetes, but unfortunately with type 1 diabetes, it is a lifelong disease. There's no, as of 2025, this current time, there's no cure for it. Someone who has type 1 diabetes will have type 1 diabetes for the rest of their life, unless a cure is found. And I say, no changes to your diet are really going to be able to stop that for you, or to stop you needing insulin. We all need insulin to live. Type 1 diabetics don't produce any insulin at all. And so there's not any special type of diet. I've heard people recommending things like, if you cut out carbs, then your daughter won't need insulin. That's not true, because everyone needs a little bit of insulin in their system anyway. And I also don't think it's recommended for a young child to cut out a complete food group right from their diet, because they're still growing. That might be a decision like an older diabetic might want to make if they wanted to cut down on the amount of insulin they're using. But like I say, for my daughter, whether she uses up all the 100 units in her pod or whether she only uses 10 over the 3 days, it wouldn't make a difference, because once the pod's on, then it's on anyway. And then the pod is just sort of responding to her insulin needs, and I'm telling it as well as she eats. So I think that's another myth I wished was not out there. And I do think that I've noticed a movement towards calling type 1 diabetes type 1, as opposed to by the name of diabetes, which I'm trying to do more myself, but because I've been brought up with calling it diabetes, it's a little bit difficult for me to switch. But yeah, I've noticed a trend towards saying, like, my daughter has type 1 instead of diabetes, because I think that people are hoping that there'll be more understanding if people know that it's a completely different disease to type 2 diabetes, that it's, like I say, it's brought on differently and it's managed differently, and it's not something that you can cure. So all that to say, thank you for tuning in and listening to my very long story about my daughter's diagnosis and how we currently manage her diabetes. This is something I would love to update on in the future, because it's exciting to think that things are going to change, just like they've changed from my dad, using insulin pens and finger pricks, to now my daughter using having a continuous monitor and the pump. Another thing I would like to make a video on in the future is my daughter's celiac disease and how we're managing that. But it's less than a year since she's been diagnosed with that, and so I feel like I'm still finding my way around it, and I still get caught out in sort of certain situations with people offering her gluten or her accidentally eating gluten. So I don't feel like I'm sort of experienced enough with that yet to talk about it. But that's something I would like to talk about in the future. So I hope to catch you in my next video. Please, if you have diabetes yourself, or if your child has diabetes, let's connect in the comments. I think one of the benefits I've noticed, actually I've really noticed it this past summer, of people wearing sensors and pumps is that now other diabetics are more recognisable. And I've had people, come up to my daughter and be like, oh, look, we match, because they've also got a sensor on, or, just starts up a conversation about a disease that can feel quite isolating sometimes. Anyway, all that being said, I will see you in my next video. Take care. Bye.